Thanks everybody for getting on this broadcast. It's a good afternoon, but it's a tough afternoon. This morning we received more devastating news for American workers. A record high in new unemployment claims, 6.6 million more in 1 week, added to the 3.3 million claims from last week. That's almost 10 million Americans who, through no fault of their own, have lost their job because of this pandemic. 10 million proud, hardworking Americans who need help now more than they've ever needed it, who are about how they're going to make. They're worried about their rent. They're worried about how they're just going to get the next meal. Worried about how they're going to pay the bills to keep the food on the table, and above all, worried about the health for themselves and their loved ones and their neighbors. My heart goes out to each and every family who is struggling to get through this time of unprecedented national crisis, and I think along with dozens of other elected officials, if not hundreds of public health officials, Democrats and Republicans, are calling for President Trump and his administration to do the right thing and open up a new enrollment period for Obamacare so that people who need insurance now can get it. Now's not the time for petty politics. This is a national emergency. Our government should be doing everything possible to protect people's health and well-being. And the good news is the U.S. government took important action last week, passing into law a $2 trillion CARES Act. It was the namesake of the remarkable feat of bipartisanship that Nancy and Schumer and the Republican leaders put together to address the real national crisis. And Democrats made sure it provided reassurances and relief for American workers. But now, President Trump has to make sure it's implemented swiftly, transparently, and effectively. Yesterday, the Trump administration suggested that I should call the president and offer to help. Well, I'm happy to hear he'll take my call. My team's working with him to set such a call up. And I've been offering my advice and proposing policies for what I thought should be done for the last several weeks. I said back on March 12th, when I released my initial plan for COVID-19, that the president is welcome to adopt every single thing I suggested he thought was worthwhile, and I wouldn't make anything about it except compliment him for the job he was doing. Today, I make the same offer with regard to my new 10-point Make It Work checklist. I've done this work before. I can tell you it takes more than tweets and press conferences. It's hard, it's painstaking work. This is when leaders have to lead and governments have to work. I was in charge of administering the $800 billion Recovery Act. So I understand that the devil is in the details. It's about follow-through. The CARES Act provides more money to help people. Now, how do we make sure it gets to those people as quickly as possible and with as little red tape as possible? You know, there's money to help keep small businesses afloat. How do we make sure the small businesses get access to those funds so they can make rent and keep workers on the payroll? There's money for large corporations. How do we make sure that there's a rigorous oversight to ensure it is used to help workers, not enrich top executives or well-off investors? Those are the kinds of questions that the president should be asking now, and he's responsible for that. And frankly, he hadn't had a great record so far when it comes to delivering real help to the American people in a timely fashion. I hope this time is different. He may not like it, but being president is about taking responsibility. The blame game can't cut it in this crisis. Too many lives are at stake. There have been too many. Look, we have to be clear with our objectives and our timelines and the benchmarks. There should be one person responsible and accountable for making sure things are coordinated and done correctly. There must be transparency at every step of the way. I'm releasing a full checklist on joebiden.com. It's just a starting point. But let me offer a few highlights. We need to get the unemployment insurance checks out as quickly as possible and in full. Now, that sounds simple, but states are already overwhelmed by the millions of claims. They've never had this many at one time, with more to come. States need more staff to administer those offices, better technology, more robust systems to both accept claims and get funds out the door. The White House should have the backs of the states, not just taking it. It's the responsibility of the White House and the federal government to help. Look, the promise of the Cures Act is that your average worker will be made financially whole even if they lose their job. The president has to deliver on that promise. He should immediately stand up a team that's empowered with a senior leadership to help states solve challenges that they inevitably are going to face distributing you unemployment benefits. He should give them all the resources they need to increase the capacity to do that. He should issue clear guidance about the broadest possible eligibility that's out there, including gig workers and those furloughed. They are qualified as well. So working Americans understand that help that is available to them is available, and how to get it and how to access it. There's no time to lose, and this is going to be difficult, but it has to happen now. We have to make sure all small businesses, for example, get help fast so they can keep people on the payroll. It does no good for Congress to move quickly if the administration can't get these loans to small businesses that are in need now. For millions of American workers, payday is tomorrow. Tomorrow. Every single eligible small business needs to be able to access the help, regardless of how small they are, whether they're in the suburbs or struggling in an urban community or in a small rural town, women-owned businesses, minority-owned businesses. The money should be going out the door as fast as possible, not just to the well-connected, not just to a few splashingly announced examples. Look, to all who qualify, that's what it has to be. Everybody who qualifies. As it's designed, the program depends on the willingness of the private banks to provide government-backed, they're not taking the risk, government's backing the loans, government-backed loans to these small businesses. But that's not been their strong point in the past. That's why I'm calling for a Bank Defense Production Act authority to make sure that the wide range of banks are processing loans for all those who qualify within a few working days of application. They can't turn qualified applicants away, but they can determine who's qualified or put them at the back of the line. It's also calling for removing the cap on this funding so that no eligible small business or nonprofit is left behind. Look, the government is providing the guarantees. Now the banks have to step up and do their part. I know it's going to be hard, but they have to step up. We also need to keep people on the payroll by using work-sharing authorities to the full extent of the law. That is, you have two workers, you each go in half-time, they're each entitled to get unemployment so they're as if they're being paid full-time. The White House should expand the work-sharing program to all 50 states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands. These programs help employers keep more workers employed, with the federal government making up the difference in lost hours. An additional $600 for laid-off workers in the CARES Act should also be available to encourage work sharing, to help keep workers employed. Every person on work sharing is another person still in a job. And this is going to take bold, creative federal action in partnership with the states, and they should get to work. We need to get direct cash relief payments out to as many people as possible, as quickly as possible. Again, this may sound straightforward, but no American should have to wait a single minute so Donald Trump can put his signature on a physical check. It isn't about him. It's about families that need the cash now. Payments should be electronically made or via prepaid debit card, and they should be going out the door now. When it comes to protecting against waste and abuse, either by corporations or this administration, we can't take the cop off the beat. Donald Trump has threatened to block the work of the Special Inspector General that Congress created to oversee the $500 billion fund for corporations. The idea of taking that authority away is simply unacceptable. As I said, I oversaw an $800 billion program, the biggest recovery ever passed before this one. And it was hard work to make sure there was no less than 0.2% fraud when it got all finished. That's what it was. Less than 0.2% fraud or abuse. But we did it. And it mattered because every dollar wasted doesn't get to a worker or a family who badly needs it. We can't let that happen. The president has to give the inspector general free rein and full transparency. If he won't, Congress has to hold the president accountable. In addition, Democrats want important oversight protections against the money being used for stock buybacks or executive compensation, but the administration can and should set the bar even higher. I've laid out a number of conditions to make sure companies aren't taking the money and then turning around and firing workers or outsourcing jobs. Finally, start working on phase 4. We need another plan before this is over. We've gone through the first 3 phases. We're trying to implement phase 3, 2, and 3 now. We can't wait, though. The tragedy of this crisis is how much pain could have been avoided with swift, decisive action. We already know we're going to need more resources, a lot more. More people are going to need to help. Gaps are going to become apparent. We're going to need to fix them and fill them. Some people were left out of the CARES Act. We'll need to help them as well. America's long-term recovery is going to require far more investment, but it needs to be smart and effective. So let's start now so we don't waste valuable time. That's how this administration can make it work, and make it work for all the American people, not just big businesses and corporate executives. Families struggling to make rent, workers who have had their hours slashed or been laid off, our frontline healthcare heroes who can't wait for help. And above all, this administration still needs to set up its response to the public health crisis, including getting hospital and healthcare funding in the CARES Act out the door to the hospitals and healthcare folks. For a time, the president was talking about this crisis being a choice between protecting public health and reopening the economy. That was a false and dangerous way to think about the problem. The virus is why we have this economic crisis. Failure to arrest the spread of the virus is the direct cause of economic pain. Americans are suffering today, this instant. Nobody, there's none of us who will think this matters. No amount of relief will help families ride out this if we can't break this infection curve and break it quickly to stop the spread of the virus and save American lives. That's priority number 1. So thank you all. Thank you all for taking time to listen. I know there's a lot I haven't spoken to, but I'm happy to try to take your questions now. Thank you very much.
Thank you, sir. We are now going to start taking questions. If you'd like to ask a question, just remember to please raise your hand at the bottom of the screen. The first question will go to Andrea Mitchell from NBC. Andrea, you are now unmuted.
Hello, Andrea.
Thank you very much. Hello. Thank you, Mr. Vice President. We are seeing heartbreaking appeals from the frontline health workers all over the country, especially in New York City, which is the crux of the problem right now. And the governors are telling us, Democratic and Republican governors are saying they still are not getting supplies. Still, there's no one from FEMA who seems to be in charge. Can you say what you would tell the president if he does take your call about what needs to be done to get this aid, the protective gear, the equipment they need to these hospitals, to our frontline health workers, to the EMS workers? And secondly, you're calling for a 4th package, but Senator McConnell has said he's not interested in it. Nancy Pelosi told me today she's already ready and working on it. What would you say to the Republican leadership and to the White House about the need for a 4th package?
Well, let me start at the front end. I have a son-in-law, Ashley's husband is a surgeon up in Philadelphia, one of the big hospitals. And I talk to him every day with other healthcare providers and experts. And he was telling about a friend of his up in New York who said he just had 2 young men die on his table. One was, I think, 26 years old, and I think a marathoner, don't hold me to that, in great shape. Another was 28 years old. This is only going to get worse. It's not going to get better. And there's a real sense of panic that's occurring around the country and among some, I won't say panic, but great concern among healthcare providers and first responders. So, number one, we're in a situation where the president, as I was coming down to this makeshift studio, I was told by a staff member that the president says he's going to fully implement the Defense Production Act now. And so I said, great. And I stayed a second. As I was a few minutes later, I said, what'd he say? And I read the statement. It's all about ventilators, which is really important and should have been done 4 weeks ago. But he should employ that Defense Production Act for all the things needed: gloves, masks, face shields, gowns, etc. That should be done yesterday, last week, a month ago. Get it done now. And for example, tests. We're in a situation where we have tests that are not being distributed, number one, because there's no one person, no commander in the White House or the administration like a military commander determining distribution of what is available. And we have to be using the Defense Production Act to get companies who have the capacity to gather all the materials needed for the test, assemble them, and move now. Use your full authority. This is a war. Act like a commander-in-chief. Use it all. And so I'm a little worried that that has not been expanded. And, the healthcare workers, and I watch your interviews and everyone else's interviews on TV, and there's so many examples of these. I watched last night a young doctor saying how frightened he was to go into the room, but he said he thought about how soldiers go in, and so why didn't he have more courage? He's going to do it, but it's frightening to go in. And people are really worried. Let's get on the job of providing what is needed. You asked the third part of your question related to whether or not, what was the third part of your question, actually? You asked three pieces.
Sorry, it was the question about whether or not a fourth package could be done.
Yes, I'm sorry. Yes.
If the majority leader in the Senate is saying no.
Well, the majority leader of the Senate was wrong and slow the first time around, and he's wrong and slow this time around. Look, more has to happen. There is no possibility that the monies that provided to try to just get this under control are going to be enough to deal with the aftermath, both economically and in terms of the health of the country. We need to do more, which I'll be speaking to, and so I'm going to talk to the president about if he takes my call, if that gets set up. We need another package. There's a lot of people that are going to be left behind. There's a lot of holes we're going to find, as well-intended as the legislation was, that didn't get covered. For example, you have students out there with significant student debt. They're now in 3 cycles. They had this generation from this one that are 18 years old all the way to the people who are in their early 30s. Look what they've gone through. They've gone through 9/11. They went through the economic downturn. They went through what we're going through now, and it's put them behind the 8 ball. We can't make the same mistakes. We know what we have to do. We should be examining what are we going to do to plan to make sure that the next virus is begin to prepare for it now, or if this comes back, if it rebounds. So there's so much we have to do. Social Security recipients should be getting another $200 to $300 in their paychecks now, in their Social Security checks now. They need the help now. So there's a whole range of things that are fully within our capacity, and we should be focusing on what we have to do about it now, in my view. And I think you're going to find, I predict to you, that no matter what Mitch says, he's going to be back handling another package. The idea that this is the end of it, I will be dumbfounded if that occurs, and disappointed.
Thank you, Mr. Vice President.
Thank you.
Great. Our next question comes from Bill Barrow from AP.
Right. Yes, Mr. Vice President. Senator Sanders is kind of making a new push, regardless of the gap between you two and delegates, to try to bring the conversation back to Medicare for all, saying that this scenario proves the private sector can't meet this kind of demand. Can you restate, like, why is it that you are still coming at this saying that the public option is the better model to get more people covered and more people care?
If you had the Medicare for all option now, it still has to be implemented by the federal government. Look, here's the point. the idea that this would have stopped the virus from occurring, the idea it would have been able to be implemented earlier, the idea it would have fundamentally changed anything is just not accurate. And besides, you got to pass what is a $35 trillion bill over the next 10 years, mildly complicating at the same time here. And so what we should be doing is having the Affordable Care Act, add the public option for those who want it, meaning Medicare, if they can, if that's what they want, rather than keep their own health insurance policies. If you notice, it's not about whether or not the health insurance is available to people that have private insurance. It's not about that. Now it's about whether or not the government is going to be able to implement all the things that they're supposed to be doing. And so I don't see where Medicare for All would make any difference in terms of the speed with which and the recovery rate which would occur if, in fact, it existed.
Do you have any concern that Bernie's push on this could confuse the issue and kind of take people's eye off the ball as you see it?
No, I don't. Look, I think, Senator Sanders is passionate about this. He believes it to his every fiber in his being, and I respect him for that. I just disagree with him.
Great. The next question is from Jessica Dean from CNN.
Hi, Mr. Vice President. Thanks for taking my question.
Happy to.
You mentioned your potential call with President Trump, and I'm curious, how close do you think you are to making that happen, and how confident are you that this could actually be a productive conversation, that he would take any advice, that he's open to so many of the plans that you've laid out?
Well, just taking Kellyanne Conway at her word, she said the president, why am I not suggesting what should be done? I laid out a 19-point plan, some of which was accepted, some was rejected. When I laid it out, I said that I think there's things that the president can use early on from the experience we had before and take a look at it. And if he did, I wasn't going to be out there saying he took my idea. It's a matter of the president doing what can most effectively get things done now. And but I don't know. All I know is that in the conversations in the past, it's been a long time I've had with them. They've been respectful. They've been straightforward. And I'm not doing this to criticize. I'm doing this to say, this is what I think you should do. For example, on the Defense Production Act, I would strongly recommend the president move beyond just ventilators, He has the capacity to do that. I think it would not be unusual to suggest, maybe they're already thinking of doing it, having one commander-in-chief, one person in charge of making sure the allocation of all the equipment that's needed for protective gear is under the control of one person so they all know where it's going, just like if it were a war, just like what happens in a wartime. And we've talked to the president, says he's a wartime president. This is a war against this virus. There's a number of specific suggestions that I know from in the past worked, and some I think would work. And I'm prepared to offer them to the president. I understand if he doesn't want to take my advice, but it won't be, I told you so, Mr. President. It won't be if he decided to do what I suggested, I go back and say, well, I told the president to do that. This is beyond politics right now. I mean, the projections that I get in the morning when I speak to the docs that I work with could be really dire. We're talking about a lot of people potentially dying. And we're now leading the world in the number of cases. And we've got to act more swiftly, more rapidly. And, we've been through this in a slightly different way in the past. And I hope they could learn some lessons from what we did right and maybe what we did wrong.
Thank you.
Thank you. And the next question goes to Trevor Honeycutt from Reuters.
Hi, Mr. Vice President. So my question is about the Wisconsin primary and whether you think it's still appropriate to have in-person voting there, considering the fact that the Democratic National Convention has been pushed back and public health officials say it's important to stay home at this time.
Well, the answer is I listen to the scientists. a convention having tens of thousands of people in one arena is very different than having people walk into a polling booth with accurate spacing to 6 to 10 feet apart, one at a time, going in and have machines scrubbed down. But I do think there are going to be a lot more. I think you could hold the election as well, dealing with mail-in ballots and same-day registration. I mean, there's a lot of things that can be done. That's for the Wisconsin courts and folks to decide. But I think it's possible to do both, to have both more mail-in ballots. People, and today is the last day, I guess, till 5 o'clock to ask for one. It was an hour time difference from where I am in Wisconsin. And I think it could be done based on what I've been hearing from the news and what I understand the governor and others are saying. But that's for them to decide.
Thank you.
Thank you.